Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Assalamualaikum warahmatullahi ta'ala wabarakatuh to everyone, respected professor, colleague and all participants. I'm Rugaya Estar binti Muhammad from UPTN, representing my team to present today on a topic that is both timely and critical: the role of asatizah in addressing mental illness among Generation Y. Mental illness is no longer a hidden issue. Globally, WHO report that 1 in 8 people is living with some form of mental disorder. Among them, young adults, especially those born between the early 1980s and late 1990s, commonly referred to as Generation Y, are among the most vulnerable. Why? Because this generation faces some factors, including economic pressure, digital overload, job instability, and shifting cultural expectation. In Malaysia, the situation is worrying. The NHMS 2019 revealed that around 2.3 million Malaysians affected by mental health issues. These higher cases are among youth between 16 to 35 years old, which corresponding to Generation Y. Despite available psychiatrist services, many people do not seek help because of stigma, cultural perception, and fear of being labeled weak in faith, discouraging them from approaching clinics and counselors. This raises an important question. If professional services exist, why they are underutilized? The answer often lies in stigma and cultural factors. Many young Muslims still view mental illness as a weakness of iman or as a supernatural disturbance. As a result, rather than consulting psychologists, many people prefer to seek guidance from asatizah. Why? Because the asatizah are trusted as religious teachers and community leaders. Historically, asatizah have always more than just teachers. They are mentors, spiritual guide, and moral compasses for the community. When people struggle in their life, they often turn first to their ustaz or ustazah for advice, prayer, or comfort. This transposition asatizah as natural allies in mental health promotion. They may not be clinical, but they can first provide spiritual and ethical counseling. They also can detect early warning signs and encourage help-seeking behaviors and act as bridge between religious values and medical care. So, based on the historical position of asatizah in the community, our research therefore aim to four objectives. First, to explore the potential roles of asatizah in addressing mental health issues among Generation Y. Second, to identify current gaps in knowledge, training, and support for asatizah regarding mental health awareness. Third, to suggest a framework for integrating Islamic spiritual support with modern psychological practices, and fourth, to promote interagency collaboration between religious institutions and mental health professionals. To address this objective, we focus on four main questions. First, what roles can the asatizah play? Second, what gaps exist in their training? The third, how can faith and psychology be integrated? And fourth, what models of collaboration are feasible? To answer those questions, we propose mixed methods design, quantitative and qualitative method. In quantitative method, the data will involve survey with 200 asatiza and 300 young adults from Generation Y, and we will use MHLS as survey tools, and we will focus this research on literacy, stigma, and attitudes among them. And with quantitative methods, the data will include interview with 20 interviewees from asatiza, 20 from youth, and focus on group discussion with some professional. In this way, we capture both the statistical prevalence and the human experience behind it. Now we go to the finding. Preliminary finding shows that 1 of 5 young Malaysians has symptoms of depression or anxiety. Yet only 31% of them seek professional help, despite more than half consulting and asatiza first. This confirms the central role that asatiza already play, often informally, in supporting mental health. Based on the data, we suggest 4 roles for asatiza. First, as a mental health literacy advocates, for educating communities that depression and anxiety are medical conditions, not weaknesses of faith. Secondly, as a spiritual and ethical counselors, for offering Quranic wisdom, doa, and guidance that strengthen resilience. Third, as an early detection and referral agents for recognizing limits and directing serious cases to psychologists or psychiatrists. And last but not least, as a community engagement partners in collaborating with universities, NGO, and hospital to run awareness program. What is the significance of our study? The significance of our study lies in its potential to bridge the gap between spiritual care and mental health support, offering a holistic model that empower asatiza to strengthen resilience, reduce stigma, and foster collaboration with mental health professionals for the well-being of the Muslim community. To complete all this suggestion, of course, there are many challenges, include lack of formal training in mental health, ambiguity about the asatiza roles, resistance from the traditional institution, stigma in Muslim communities, and limited resources for training and partnership. To overcome these challenges, we propose several strategies can be applied. This is develop training modules on mental health literacy for the asatiza, establish clear referral protocol with hospital and clinics, engage religious councils and institution to endorse collaboration, and come out with pilot small scale programs through mosques or youth NGOs before nationwide rollout. Actually, to implement this, we can learn valuable lessons from the other countries. For example, in Singapore, MUIS introduced the Minda Sehat initiative, a program training the asatiza in mental health awareness. And in Jordan, the imams collaborate with psychologists to deliver community talks about mental health. And also in UK, Muslim chaplain in universities are part of mental health support system. These models demonstrates that faith-based involved can reduce stigma and encourage help-seeking behavior among communities. For the conclusion, we notice that asatiza are not mental health professionals, but they are trusted figures who can play transformative role in supporting Generation Y. With proper training, ethical boundaries, and referral pathway, they can help to reduce stigma, promote resilience, and build bridge between spiritual guidance and medical care. This integrated model, rooted in Islamic values and modern psychology, offers a holistic approach to mental well-being for young Muslims. That's all from me. Thank you very much for your attention. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.